Are you having neck pain? Are you considering having neck surgery? A lot of times people are having neck surgeries, they're having neck fusions, and they don't know what the rehab looks like afterward. And so they don't want to have a waterfall effect. They don't want to get their entire neck fused. When we see that, people have horrible outcomes when they get more than 2 segments fused. So if you're considering having neck surgery, considering having a fusion, or if you've had post-fusion, check out this video and we'll go exactly through what we do with clients and how they get the best results. First thing that we have to talk about is we need to increase thoracic mobility. If we're gonna take stress off our neck, we got 2 to 5 millimeters of movement coming from each segment. So if you fuse 2 segments, then we have 4 to 10 millimeters of movement. So now when I start turning my head, 50% of that rotation comes from the top 2, C1, C2. So when I turn my head, the other 50% has to be distributed through my neck. So I want to be able to move, when I turn my head, I want to be able to move through my thoracic spine too, because now I've lost 2 segments of movement. So what we're going to do is work on thoracic mobility. This is the first thing that we have to move on. It's the first thing we have to work on. First thing we have to get movement through is that we need movement through the thoracic spine so we can rotate. And so I've got a double lacrosse balls here. I would want to do this on the ground, but we're going to show you on this table. I got this Mobo device where I can put pressure right here. And then if that's too intense, if you can't relax on it, then we're gonna use a towel roll. So I'm laying down, I'm gonna use the double lacrosse balls. The towel roll is fine. If it's too difficult, then we wanna use the towel roll and we work our way up over time. So I'm gonna lay this down, and then I'm pretty deliberate about how I do things. I'm gonna lay down to the side, not putting stress on my neck. Now I'm gonna get movement right here, shifting around, and then I'm gonna just breathe and relax on this double lacrosse balls. It's right below my shoulder blades right here. So I'm breathing relax. I'm allowing my body to sink down into it, and I'm getting mobility. So it's working on the soft tissues, and it's working on the rib cage and the thoracic spine. All the joints in that area need to have mobility, so I have space so I can move through that area. I'm gonna lay right here with my knees bent, my chin's tucked. If you're putting strain on your neck while you're doing this, make sure that you put a pillow underneath your head or something. We don't want to have our neck jutting up in the air. That's because you don't have enough thoracic mobility. If your chin is up like this, that means that your body, your thoracic spine and your rib cage can't curl around those double lacrosse balls. So we want to keep support right there. Now I'm gonna shimmy down. After 5 breaths, I'm gonna shimmy down and I'm gonna move about a 1/2 inch to 1 inch to the next spot. And I just breathe and relax right here. You can put your hands out to the side. I can put them on my chest. I can put them out like this. What I don't want to do is put them down. You see, if you watch my shoulder, when I put my arm down, my shoulder blade pops up. My shoulder tilts into an anterior position, and that's going to cause strain right there. So I want as much of my body collapsing on that double lacrosse balls as I can. I'm doing 5 breaths. I'm sinking down into the ball each time. So now I'm shimmying to my 3rd spot. Now I'm about mid shoulder blade. So I go below the shoulder blade, at the base of the shoulder blade, and then mid shoulder blade. Just breathe and relax, position my head, and I'm gonna relax right there. Taking my breaths again. So that's the first thing that we do. Now the second thing that we do is we're gonna do rotation. So I'm gonna put my hands underneath my head. I put my hand right here underneath the occiput on this bone on the back of my head right here, and I'm gonna scoop upward, so vertically towards my head, and I'm distracting. So I'm taking some of that pressure off of my neck. And that's what we get from a lot of our clients tell us that they always have pressure on their neck after they have surgery. So we're gonna just distract up, take some of that pressure off of it, and then I'm gonna start rotating, looking at my elbow each way, doing 2 rotations, and then I'm gonna shift my body up and the balls come down, and then I'm gonna rotate again, doing 2 each way, keeping that distraction pressure going vertically. And then now I'm gonna shift my body up again, rotating, really controlling my breath while I do this, but I'm rotating them. So I'm doing the same areas through the thoracic spine so I can increase that mobility. Then I get the muscles moving around in between my shoulder blades so I can break down some of that tissue that's built up over time. And then I'm gonna shift and I'm gonna do a exercise called threading the needle. So I'm gonna get on all 4s right here, And if this is a challenging position, you can do this from the table, but I'm gonna show you the best position is for me to sit down on my heels right here. I'm gonna come across, put my palm up, across right here, put my left hand on top of the base of my hand, and I drop my head down and rotate into it. Same thing, when I do that, I'm gonna do 5 breaths, and I wanna do it twice on each side. So I set up the opposite way, my hand goes across, my head has to rest on my arm, so I'm not putting strain on my neck. And then I'm pushing my chest and my shoulder back right here, so I'm pulling all through the shoulder blades, through my head, and I'm getting a good stretch, lengthening out all that tissue. So that's how I wanna loosen that stuff up. The third thing that I'm gonna do is I wanna activate those muscles in between the shoulder blades. So just putting our palms up. So this is a good thing to do when you're driving, is that when you're at a stoplight, just sitting down and doing a chin tuck and then pulling your shoulder blades down and back. So I'm just holding that for about 10 seconds and then I'm gonna rest and then hold that for 10 seconds. So I'm practicing really good posture. Good posture comes from co-contraction. So activating my deep neck flexors and then activating my shoulder blades, my scapular retractors, pulling back, and I'm pinching my shoulder blades together. I'm doing 3 10-second holds and I'm just getting blood flow in there. Now, there's great exercises. If you want exercises for this area so you can strengthen that up and get better long-term improvement, let us know in the comment section. But those 3 exercises are really gonna open things up. Let's talk a little bit about the anatomy. When we look at the anatomy of the neck and the shoulder blades, this is a whole complex together. So this is exposed, we just have muscles around it. But right here we have the thoracic spine, the rib cage. So here's the thoracic spine right here from here to here. That has the rib cage with it. We got the shoulder blades and all of these muscles and joint capsules. There's a lot of stuff going on right here. So that's why we get so stiff. We're sitting for long periods of time, and that's causing us to get stiff in the front of the chest, pulls those shoulder blades together. And when those shoulder blades are being pulled forward, they're constantly pulling on the neck. So we want to decrease that stress. And we decrease it by increasing mobility right here. We got the double lacrosse balls below the shoulder blades, increasing mobility here, increasing mobility here at the base of them, and then increasing mobility right at the mid shoulder blade. And then when we're looking to activate muscles, we're looking right here. We have our upper trap coming up, typically is overused. A lot of people carry stress right there. We got our middle trap coming across, and then we have our lower trap coming down. We need to use more of that middle trap and the lower trap. And when we do that, we're able to get into a better posture for longer periods of time. Every inch that your head comes forward, it doubles in weight. So it's something around 35 pounds, 36 pounds when you start coming forward that you're putting pressure. And so your neck muscles are constantly engaging and tightening up. So we want to make sure that we're getting into a good posture, and that movement comes from right here. That the thoracic spine, the rib cage has to drive up like an arrow shot me in here and is coming out the front of my chest right here. So it's shooting me up. I'm able to maintain a neutral position for my head. And that's going to take a lot of stress off of your neck. We want to do that consistently. So this is a twice-a-day routine, maintaining mobility right there and then strengthening up those muscles. Make sure to leave us a comment if you want more exercise-related videos, and we'll put those together for you. And also check out our videos on neck pain. We have a ton of them that we've posted already, but it's always going to be related to the neck and the shoulder. So if you're doing something positive for your shoulders, it's good for your neck. If you're doing something positive for your neck, it's good for your shoulders. We'll see you in the next video. Get mobile and stay active.